Hey guys, this is Coach Bill with Bill Mabry Online Coaching. Hope you guys are having a great day so far. Today, guys, again, a topic that's very important for those of you that are 50, 60, or 70 plus. I've done many videos now in the last few, probably in the last few weeks, on how important understanding and knowing total testosterone and free testosterone is for those of us that are seniors or baby boomers. And now it just seems like a lot of our younger generation are having issues because of imbalanced hormones. So today, guys, I want to talk about a book I published that is a step-by-step explanation on how important total testosterone and free testosterone is for men and women. That's right. Both of those, total testosterone and free testosterone, is also important for women to know also, because they seem to have more of a mental issues when their hormones are imbalanced. And some of us are going to have to actually bump start our hormones by doing some type of hormone therapy. And I mean, I have been working with people who have imbalanced hormones for years. We work very closely with a hormone specialist who is an MD. So what I want to do, guys, is I want to take you to my published book. Okay, guys, so here we are, and this is the actual book that I published on bioidentical hormones and versus synthetic hormones, because there's a lot of misconception about which one's better. And over the last 8 or 9 years, we now realize, by working very close with this doctor, that the healthiest and safest way to go, if you're looking to bump start your, and most of you are going to have to bump start your hormones, especially if you're 40, 50, 60, or 70 plus, is by doing bioidentical hormones, which are plant-based and that are natural. And it's the safest and healthiest way to go. And this book is going to explain the difference between the bioidentical hormones, which is a natural way of hormone therapy, versus the standard American synthetic hormones, which most doctors prescribe, which is not safe, and there are a lot of side effects. So what I'm doing here, guys, is there are some general disagreements in the medical community as to what constitutes normal testosterone levels for men and women. And that's a big factor, guys, is that I've noticed that a lot of these sites are showing, okay, this is where a man should be when it comes to total testosterone and free testosterone, and this is where women should be when it comes to the same, total testosterone. But this problem is they're not really talking much about free testosterone for women. And when you go down to do a blood test, when a man does his hormone panel, it'll always show, well, most of the time it'll show total testosterone and it will show free testosterone. When a woman goes down to get a hormone panel done, it only shows total testosterone, and that's not wrong. That's wrong. You need to understand your free testosterone levels as well. So for the last 8 years, like I said, we've been working very closely with a bioidentical hormone specialist who is also an MD. We have learned when a man and a woman's hormones are out of balance, especially those of you 40 and 60 plus, weight loss is much slower, and sugar and bad carb cravings are much worse. We've noticed that not only with our clients, but also with ourselves. Also, it is shown by research that free testosterone is important for those of who are seniors, men and women. That's, guys, all of them, that is huge. Free testosterone, you need to understand that. Now, if any of you are suffering, this comes from the medical side, if any of you are suffering from these symptoms, most likely you have low testosterone, reduced sex drive, both men and women. For men, dysfunctional erectile dysfunction, depressed mood, difficulties with concentration, memory, increased body fat. That's huge. That means increased fat weight as well. Enlarged male breasts, which means man boobs for young men. That is huge today. That's an epidemic amongst the younger men. Decreasing muscle strength and mass, those of you that are 50, 60, 70, 80 plus, that's a big issue with those. That's why so many seniors fall and break bones. And that's why so many seniors are also weak, because they're losing muscle mass because of low testosterone levels. Decrease in endurance, prostate issues for men, that's huge. Hot flashes in women, sluggishness, and sleep disorders. In women's bodies, testosterone serves several functions. It contributes to sex drive and libido, plays a critical role in bone growth and strength. Yes, women, even as a senior, you guys, if you have the right plan and the right strength and conditioning program, you guys can also add lean muscle mass and maintain your muscle mass and bone strength as you age. It improves energy, promotes overall ovarian health. Now, this is what I took out of the medical sites. Maintaining optimal testosterone levels in men and women is critical for the body to carry out the many functions that is essential hormones is used for. Energy, sexual ability, muscle tone, bone density, conjunctive functions, metabolism, hair growth, and moods, healthy prostate for men, and healthy heart. Guys, that heart is the biggest one. That is huge. There's a lot of good research showing that low testosterone levels in men and women affects the heart. All depend upon a proper amount of testosterone circulating in the body. That is what is sad. When women do a hormone panel, like I said before, they don't even show the free testosterone, which is wrong. You must understand that your free testosterone, it plays a huge part in not only maintaining muscle mass or maintaining a good bone strength, but also adding muscle mass as well. For men with a test result of 3, okay, now this is where the misconception comes when it comes to the levels of testosterone in men and women. So for men with a test result of 300 and below, for women 100 below, most likely you are dealing with low testosterone. This is coming from the science side. There are many other factors to take into consideration when a doctor is making the determination. Of the biggest one is, how do you feel? So that's what it all boils down. How do you feel? Most doctors do not ask this question. This is why it is imperative to seek out a treatment from a hormone replacement specialist who will do more than just look at a number, but will instead assess the entire individual bioidentical hormone, which is a bioidentical hormone specialist. Some studies have shown that men and women over 60 are often found to have total testosterone levels of 241 in men, and women under 100, which could explain many changes they are experiencing. Those are the symptoms I'm talking about. Also, this site is also saying that, I'm going to give you an example. This is my wife. She's 68 years old. She stays consistent with her total testosterone at 200. Her free is around 30. I am 70 years old. My total testosterone stays around 1500, and my free is around 130 plus. We both feel our best at these numbers. Guys, I have let myself go down below the 1500, as low as 600, and I feel horrible. My strength isn't there. My sleeping isn't as well. My mood changes all the time. I just don't feel good. Okay, guys, I'm back. So as I was reading off the science sites of how important it is to fully understand your total testosterone and your free testosterone for men and women, this is why I published that book. Now, you can go to billmarycoaching.com, click on ebook, and that book is in there for a discounted price that you can purchase it. But all of our online coaching programs, that's one of the biggest things that you're going to learn is about hormones, because that is the root cause to those of you that have type 2 diabetes, or you're trying to lose that unwanted belly fat or body fat. It's your hormone. Got to fix that first. And you also have to identify the root cause of why is your hormones out of balance, and you have to also fix that. And here at billmarycoaching.com, we have the solution. We have all the training books and the training videos that you possibly need to be successful.